Hello, I am Dr. Priyamvada Shah. I am a senior obstetrician and gynecologist. My special area of interests are high-risk pregnancy, infertility and laparoscopic surgery. I am currently practicing at Cloudnine Hospital, Pimple, Saudagar, Pune. So let's discuss various options for the birth control measure. As we know, pregnancy and marriage are the most important events in any female's life. Like we plan for marriage, the pregnancy has to be planned and it should never ever be an accidental pregnancy. That is why we are discussing birth control measure. We have a lot of options available. Few options are for the female and few options are for the male partner. So let's try to understand the female options. The most commonly and accepted method is oral contraceptive pills. This pill has 21 tablets. One tablet has to be taken every day for 21 days. Once the tablets are over, you will resume your periods. Efficacy of this contraceptive pill is almost 100% because the ovulation doesn't occur. There could be minor symptoms, ill effects like nausea, headache, breast tenderness. However, once you are used to these pills, the side effects do settle down. So, contraceptive pills remains the #1 option for many females. Second option is intrauterine device or commonly known as copper T, where a device is impregnated with copper so as to prevent the pregnancy. This device can be fitted on the OPD basis inside the uterus. The lifespan of this device is around 5 to 10 years. So if you decide to have a second child after 3 years, you can easily opt for removing this copper T. So this is the best method for spacing two children or having gap between the two children. The advantage of this is once you insert the copper T, you really don't have to, remember every day that you have to use a contraception. But we do not opt or we do not allow this copper T to be inserted for a patient who has never conceived before. The other options for the females would be using a female condom, or there are certain injectable contraceptives which we can give every 3 months, but with which little bit menstrual irregularities are common. So these are reserved only for breastfeeding girls. Also other options like subcutaneous implants of the progesterone are really not easily available in our country. The permanent method of birth control in female remains the tubal ligation, where we cut a portion of tube either by laparoscopy or by doing open surgery so that it becomes a permanent method which does not allow the sperm to enter into the tube and conceive the egg. However, the success rate of this is, in fact, the recanalization occurs in 1 in 300 patients, but it's a very good contraceptive permanent method for females who have completed their family. Now let's come to the male option. In males, the commonest accepted method is a condom. Condoms are called as barrier contraceptive because it creates a barrier between the sperm and the egg. It does not allow the sperm to come into contact with the egg. The advantages of this condoms is definitely it's a very easy to use method and does not need any preparation for that as such. However, rupture of condoms, slippage of condoms or sometimes micro leaks are known, hence the contraceptive efficacy of condoms is around 85 to 90%. However, if used correctly, it's a very good contraceptive. The other option for males is the permanent one where we do vasectomy, like we do tubal ligation in females. We cut a portion of vas deferens in males so that the sperms are not carried from the testes up to the ejaculation point. Hence, it becomes a permanent method. Whenever a couple comes to a gynecologist for asking the options for the birth control, we always discuss different methods which are available. It is typically called as cafeteria approach for the contraception, and then the couple decides which is most suitable for them. However, always remember the pregnancy has to be a planned event and you have to opt for the best contraceptive method.